A few weeks back, I met this kid whose head was bigger than every part of his body. And then so many questions crossed my head, like, is this kid normal? Is this kid normal like any other person out there? And then I met this doctor who told me it's actually a disease and it's called hydrocephalus and it has to be treated. Well, tonight I'm being joined by Dr. Olive, who is going to teach us more about that disease. So don't even think about touching that dial. And if you want to be part of this show, it is simple. Go on our Facebook page, which is Health Facts, like the page, and then you can suggest, you can comment, and we'll be able to answer you. Stay tuned. Okay, welcome to the show, Dr. Olive.
Thank you. My name is Olive Nabiryo, an occupational therapist working with Katalemwa Cheshire Home, where we rehabilitate children with disabilities between the ages of 0 to 18 years.
Doctor, like I said a few weeks ago, I met this kid whose head was very big, like bigger than every part of his body. And when I asked, they told me it's a disease and it's called hydrocephalus. So what is it exactly?
A hydrocephalus, we normally even refer to it as a condition. It is the accumulation of too much fluid on the brain. You'll find that the brain, it's made up of cells. Those cells, they keep on producing a fluid, and that fluid goes through the spine and it will be laid off like urine, like sweat. But you'll find that within the brain there are some spaces, some pathways, and if they get blocked, that fluid will just keep on accumulating within the brain. And when it accumulates, the head size will increase. You'll see a child's eye, you'll see the child's eye sunsetting. They appear as if it's sunsetting. You'll see pronounced veins. The child will start vomiting at times, will be irritable, will start feeling as in headache, and then the child will lose appetite, and that is what we term as hydrocephalus.
So, doctor, what really causes this disease?
Hydrocephalus, as from the beginning I said, it's a blockage within the pathways or the spaces within the brain. You'll find there are several causes, including infections. Infections can be secondary to like meningitis. They can lead to blockages. Those infections can lead to blockages within the brain. Brain tumors can lead to blockages and thus accumulation of that too much fluid on the brain. Spina bifida can also cause hydrocephalus. Spina bifida is a defect of the backbone. You'll find that it also tampers with the flow of the fluid produced by the brain cells.
Thank you very much, doctor, for the explanation on the causes. But my question now is, can doctors tell that this baby has a big head when after conception?
These days when they do an abdominal scan, they can tell when the mother is carrying has hydrocephalus. There may also be other tests that can be done to tell that the child has hydrocephalus, but of now, currently we have that one of the abdominal scan where we can where the mother can get the scan and it can show that the child's head size has already increased within the womb. However, when the mother has given birth, the child may be born okay. In case the child is born okay and has no hydrocephalus, there are some signs that can tell you that the child is going to have hydrocephalus. For example, you will start seeing the child's fontanelle beginning to bulge, and it will not be pulsatile, or let me use the simple word of beating. You see the occipital, the behind of the head, it will also be a bit soft and also fall. Then you see the child's veins on the head, they will be very pronounced. The eyes will be like sunsetting. The child will be irritable, will be crying a lot. The child, if this is a child who is breastfeeding, you'll find the child will stop breastfeeding. The child will start vomiting. And when you see these signs, it is alarming that you take the child, or when you see all these signs, it's very important if you run the child to the hospital for an operation.
Thank you very much for that answer. But my question is now, what are the effects of hydrocephalus when the kid is growing up?
As from the beginning I explained, hydrocephalus is the accumulation of too much fluid. So you'll find this accumulated fluid putting pressure already on the brain or impacting pressure on the brain. So remember that the brain is the one that commands you've reached this stage, crawling, let me say, standing, walking, even all the activities that go on in the body. So because of this pressure, you'll find the child is laying with the milestones because of the hydrocephalus. Let me say it in terms like that. Because of hydrocephalus, you'll find the child laying with his or her milestone. The child will take long to sit, will take long to stand and walk. You also find that child's cognitive skills are affected. This is the child whose memory will not be very good, attention will not be very good, and concentration. And you can tell this when you're with the child, and also the time the child is standing up, going, does not give you eye contact, looking from one side to another. So those are the major effects of hydrocephalus.
So how do you treat babies or kids who have hydrocephalus?
From the effect that what we talked about, we base on those ones to start treating now the child. Right away from the signs when you note that the child has hydrocephalus and needs early intervention in form of an operation, it is always better if you can first rush the child for an operation. Then after the operation, the child will start on what we call rehabilitation services. And among these will include occupational therapy, physiotherapy, nursing care sometimes, because sometimes they present with fits, seizures. Actually, it's also an effect of hydrocephalus. So occupational therapy and physiotherapy will help the child to go through the milestones well. Then when the child is done with the milestones and now he has reached, let me say, school-going age, then you have to start working also on the cognitive side of the child. If at all the child presents with those challenges, what I talked about, the memory, attention, and concentration, then you also start working on those ones. It's mainly under occupational therapy. Then rehabilitation of these children or treatment of these children is almost like a long-term process. You'll find that as the child is now going to start school, again you have to go to the school and talk with the school teachers how to manage the child, concerning especially if the child has cognitive challenges. And then also the child will still have to come back for follow-up, let me say, of the operation that he had, because you have to ensure that the child's operation is functioning. Apart from taking the child for operation, providing occupational therapy, physiotherapy, also as a mother or as family members, you have to make sure that you feed the child with hydrocephalus very well, or I can say right, feeding right. You have to make sure that the child is on the right nutrients so that he can keep healthy and fight off diseases. Otherwise, if you don't feed the child right, this is the child who will be ending up with some diseases that will again tamper with the child's progress concerning milestones, and this is the child who will keep on going for checkup of the functioning of the operation he had. So feeding is also very key among children with hydrocephalus and spina bifida. Hydrocephalus can be managed and also can be prevented early enough if at all the mother has always been attending antenatal checkups and they detected hydrocephalus when the child is still in the womb. They can do an immediate operation when the child is still in the womb. Also, even before the mother delivers, it's always very important the mother to secure a place where she will deliver from, and that place has to be hygienic. The equipments also have to be hygienic, because they can also be a lead to the infections that can lead to hydrocephalus. The child may be okay, may be delivered okay, but as a result of the infections, due to unhygienic places, equipments, you'll find the child getting hydrocephalus later on.
Doctor, is there any special food mothers out there need to know that if they take that food, they can prevent from their kids from getting yes?
Okay. Yes, there are several foods that are rich in folic acid. I'll be mentioning them. However, also some considerations have to be taken, because folic acid is a vitamin B complex, and then it can be lost through water, through heat. There are the various foods that are rich in folic acid include fruits, for example, avocado, jackfruit. Beans also have Now on the other side, beans have, peas have, even in meat we have some folic acid, but even vegetables have a lot of folic acid. But then the mother has to put some consideration how she prepares that food. Otherwise, that vitamin B complex may be lost. Also, folic acid can be found in the fortified foods. You see, for example, the cooking oil bottles, they have that symbol F. That symbol symbolizes that this food has been fortified, and it means some additional food nutrients have been added, and among folic acid is also there. Then if the mother has not got it from the fruits and other food types that I've talked about, and also from the fortified food, then the mother can be taking some folic acid tablets. They are always provided, though it's very important if the mother can take folic acid before conception. Remember that the child's spine is formed within the first 3 weeks of pregnancy. So it is very important if the mother takes in enough of folic acid before conception, and then like up to like the first month of pregnancy, or until whenever she wants to stop. But it's vital if the mother takes folic acid early before conception.
Thank you very much for that answer. Doctor, I need to know, are there any side complications that if it's not treated, the kids can get or can suffer?
Hydrocephalus is not managed among the children. You'll find they develop other secondary complications. Remember that this is the head that is now heavier for the child, and the child has also delayed with the milestones. You'll find the child most of the time seated in one place, and if they don't manage hydrocephalus and exercises are not done early enough, you'll find the head becoming too much for the child's neck, and then also for the backbone. And these are the children you'll find with back deformities, what we call kyphosis, some with scoliosis, and even because of that sitting posture morning up to evening, not being engaged in exercises, muscles are not mobilized or the joints are not mobilized. You'll find the child also some of his or her joints getting dislocated as well. There are other several complications, secondary complications that are associated. Because even with speech, you'll find these children, they take long also to speak, some of them. The biggest number of children is hydrocephalus.
So does it also affect the intelligence of the kid?
Yes, hydrocephalus can affect the intelligence of the child. Remember, at first I talked about the cognitive challenges, poor attention, concentration, and also the memory. And if the child with hydrocephalus also has those other side effects of cognitive challenges, that means also the child's intelligence will be affected. However, this is not in all children with hydrocephalus. There is some small percentage of kids with hydrocephalus who are very even intelligent at school and they are performing very well. Though the biggest percentage, their intelligence is affected, and you'll find them, for example, stopping in like O-level and going for vocational skills training because of their intelligence that was affected.
As we conclude our short night, what advice do you give to mothers out there whose kids were detected of hydrocephalus?
The advice to the mothers who have children with hydrocephalus would be they should not neglect children with hydrocephalus. Let them bring them out to the rehabilitation centers or health facilities to be rehabilitated. Children with hydrocephalus, if they are rehabilitated, they can make it just like other children without hydrocephalus. They can turn out to be very important also family members, members who can contribute to their families. In other words, that's what I want to mean. So mothers, let them bring out all, mothers and fathers all together. They should bring out their children for rehabilitation. And another thing, they receive several information regarding their children with hydrocephalus. Let them not be discouraged. It's very important to ignore those words, and then they keep on rehabilitating their children.
Well, just heard it from Dr. Olive. If you're a mother out there and your kid has been detected of hydrocephalus, it is simple. Don't abort that kid. Go for that operation and your kid will be normal. That's all I had for you tonight. Until next time, have a good night. But don't forget to go on our Facebook page, which is Health Facts, and then like that page. You can question, you can comment, and then we'll be glad to answer you. I've been your host, Marie. Health Facts. Good night.